Hello, friends. Very excited to be here with all of you. My name is Sandesh. I am a passionate nutritionist, member of the D-Life community. Today is a great day. We've had some great conversations from folks representing, the doctors representing many flags of their countries. And I'm very interested here to progress the day, talking to Dr. Kazi. Friends, as I was reading up the internet regarding the current metabolic health issues in the rest of Asian countries, I surfaced on this paper in the Annals of Medicine and Surgery, dated 2022. It said the increasing rate of diabetes in Pakistan, a silent killer. 26% of adults in Pak are full-blown diabetics. This is just the full-blown diabetics percentage. While on the other side, in social media, we hear comments like all meat eating countries have higher prevalence of diabetes and metabolic syndrome. Why? Is that true? Is meat responsible for diabetes? We have the honor and privilege of having someone with us who's been in the ground in Pakistan, in remotest towns and villages, in NGOs, small hospitals with very minimal facilities and equipments. Welcome, Dr. Kazi, to India's first metabolic conference.
Thank you very much, and I am highly obliged and thankful for inviting me.
Dr. Kazi, please tell us more about yourself, the circumstances you grew up in, and what drove you towards getting into medical training.
I was always passionate about becoming a physician, so I enrolled in the physician training program in Pakistan in internal medicine. So we have our own College of Physicians and Surgeons, which is the degree awarding institute in Pakistan. It is very similar to that of Bangladesh. And we have a structured training program. I trained as a physician. After doing that, I worked for a few years in my country, and then I went to the Kingdom of Saudi Arabia. And that place, as happens with many expatriates, my weight started to go up and up. It was already up. And then it kind of became unmanageable. It came at a point of time when it became unmanageable. I was in excess of 125 kilos. And I was having a prediabetes, pre-hypertension. I started to develop symptoms of obstructive sleep apnea. And at that point of time, there was a time of Ramadan. I was searching for fasting information. Then I stumbled upon the low-carb and keto lifestyle. And then when I studied more and more, it made more and more sense to invest in such a thing. So within a year or 14 months, I managed to lose 1/3 of my body weight. I went from 125 kilos up to 83 or 82 kilos within 14 months. So that was enough eye-opening, or N is equal to 1 experiment for me, which just catapulted me to study more and more and more about the subject and to learn. And as you are aware that all information is shared by social media, by things like Twitter, Facebook, and things like that. So if you will search for official low-carb publications coming from Pakistan, there are very few papers. The latest one was about gestational diabetes mellitus, which was published in 2020 by Ikra Shokat in International Journal of Biosciences, in which she was telling that the females who are eating less chapatis, they are less likely to develop gestational diabetes mellitus. And those who are eating more flatbreads or rotis, they are liable to develop more chances of getting gestational diabetes mellitus. But if you will contrast this with Facebook, then you will find multiple groups originating from Pakistan having thousands of participants, and literally hundreds of them are sharing their ongoing success stories about weight loss and weight maintenance on low carb and various versions of keto. So all the development that is taking place through the social media. The official publications are very slow and reluctant to accept such things. Still now, this is the situation in Pakistan. So as you touched upon the incidence of diabetes in Pakistan, I was also searching about this, and I was searching the IDF, International Diabetes Federation website. So that is putting Pakistan on number 1 with 30.3% prevalence. So if you will contrast this with United States or India, the 2023 prediction on IDF website is around 10%, both for India and for United States. So I don't know why Pakistan is so high that the number of diabetics in Pakistan are 3 times more compared to those in India or to the United States. And after Pakistan, then there are a few small island nations where people have genetic defects which predispose people for developing diabetes mellitus. And then in the higher 20s, the Middle Eastern countries are coming, the Bahrain, Kingdom of Saudi Arabia, Qatar, and Egypt. So these prevalence-wise, these countries are on number 2. Probably the reason is that weather is too much hot, and the cold drinks and the sweet drinks advertisement is too much. And the most important thing in that area is that you can buy a can of Pepsi or Coke at a lesser price than that of water. So water is more expensive sometimes compared to soft drinks. So you can well imagine that people would throw away the money at soft drinks because nobody wants to purchase water at a higher rate than that of soft drinks. So it is for this reason that, but Pakistan, probably nutritional deficiencies in the mothers and the small babies, they also play a great role. Vitamin deficiencies such as vitamin A and vitamin D, they are very common in pregnant females, and it is also associated with the prevalence of increased diabetes. I was also looking at per capita sugar consumption in Pakistan. So as far as that is concerned, the data I got was from in 1965, average per capita sugar consumption was 4 kilograms. And the latest data for 2023 is 21 kilogram per head. So that is in excess of 60 grams intake of sugar per day. The WHO maximal recommendation is 25 grams per day. So the relevant data from India is the average per capita Indian sugar consumption is 29 kilos, which is 50% more than that of the Pakistanis. But for India, the data is India is a very big country, so 40% of sugar consumption is coming from 3 states, that is UP, Maharashtra, and Karnataka, probably due to the regional foods and the festivities associated with that. So I think that in South Asian people, the main problem is the livers cannot handle fructose load. The more fructose that is delivered to the livers, that results in people who are thin from outside and fat from inside. Means their liver is full of fat, and outside they don't develop any findings of metabolic syndrome. So if for the lay person or the casual person, metabolic syndrome is when you develop obesity and hypertension and your blood sugar and triglycerides start to go up. Your waist circumference goes up, and then everybody tells you that you look fat. But it is not essential in India and Pakistan or China for that matter. Person will be very thin and lean. He has ideal waist and the blood pressure is all right, but liver is extensively diseased because the liver cannot handle the extra load of fructose that is delivered to it again and again and again. So probably this is the main reason that this fatty liver disease, what is also known as metabolic associated steatotic liver disease nowadays, they call it MASLD. So that is much more common, and that is a precursor of leading towards diabetes. But specifically, no RCT or big data is available which can tell us that why we are so much different from Caucasians, why South Asians, they have much more inherent insulin resistance and they have much less lean muscle mass compared to the Caucasians or the English people.
Thank you, doctor. I think, numbers are hard facts. I don't think anybody can deny that. So thanks so much for sharing and giving a comparator, from different countries, in Asia. I think that's the unique perspective you bring in. Doctor, a little curious to know what's the typical diet or the meal plate in Pakistan? What's on the plate? And if you can describe a little bit.
The majority of the plate or the 3/4 of the plate consists of wheat or various versions of wheat. According to a study published just a year ago, 72% of calories of average household in Pakistan are coming from wheat. Usually it is the flat bread or roti, or in some part of the country, it comes by the version of naan, which is just cooked in a tandoor. So it is essentially the same thing. The wheat, the Pakistani plate is very simple. 3/4 is consisting of wheat, and 1/4 is consisting of sometimes vegetables, sometimes lentils, and sometimes some version of protein, such as chicken or beef or mutton. But actually, due to the economic downturn, the high prices of commodities, and the recent flood which came in Pakistan 2 years ago, practically 1/3 of our country was submerged in water. Due to that, even the agricultural output was severely affected. So at this point of time, due to the inflation, I am afraid that even more percentage of the calories will be coming from wheat, probably around somewhere 80 to 85%. That leaves very little space for things like protein or fats. But fats also, whenever people are pushed financially, they go for easier options. So easier options are some combination of wheat or potatoes and oil and lots of sugar and salt. So traditionally also our food pattern and food platter is similar to the Indian states, majority of Indian states. But I am afraid that even now the wheat is even a more prominent place. So the carbohydrate intake is probably 3/4 of the total caloric intake.
Thank you, doctor. I think that's very, very enlightening. I just wanted to, pivot a little bit to when I opened the conversation around meat, and is meat the cause for, diabetes? What's your, you've been, working in really, in the entrenched parts of Pakistan. And I wanted to understand a little bit more around, as you're coaching your patients, how are you talking to them about meat? I know there's a lot of fear. So what are your views about meat and diabetes?
Meat is the best thing you can take if you are a diabetic or are suffering from obesity. Any version of protein will do. I would advise anybody to experiment, get a CGM monitor, continuous glucose monitor, and eat as much meat or eggs as much as possible. It will not spike your sugar at all. So these are the most highly satiating foods. You will feel fuller very quickly. And as Dr. Sean Baker was telling yesterday, nobody can eat more than half kilo meat at a single point of time. It is very unlikely, highly unlikely, that anybody can eat more than 2 pounds of meat in one sitting. I advise my patients to revolve their diet around the meat and eggs as much as possible and add other things while they go along. I usually start by telling them that first you have to stop sugar completely. So that is a deal breaker. So if they cannot stop sugar or jaggery, in that case, it will be useless to go further. So in step 1, I try to stop the sugar. After a week or so, I call the patients again and check their data, their blood sugar reports. If this is satisfactory, then I advise them to stop potatoes and rice also.
Okay.
So if I will say to them to stop roti, that will be a deal breaker for majority of patients. They cannot tolerate it. So wheat and fruit is something which is a no-no for a first conversation for the patients with which I am working with. Usually they would stop sugar. Once they will stop rice and potatoes, then gradually I can tell them to cut back on wheat or eat more psyllium husk or various combinations of coconut flour, depending on the availability in local area. The main problem is that patients agree with cutting some groups gradually. I don't go very low carb in the very beginning, but due to financial reasons, getting adequate and good quantity of meat is very difficult. Usually people eat chicken once a week or so, and other meats on some occasions, like if they are invited to a marriage ceremony or there is a Eid time or Ramadan. Usually people, they don't afford to eat meat every single day. And a common person. Obviously, 10-15% of people can afford to go full carnivore in Pakistan. It will be possible for them financially. For majority, availability and cost will prohibit them from doing so. Another problem that I frequently face is what kind of oil. So even in Pakistan, we have various combinations of virtually trans fat-free hydrogenated oils. This stuff is banned in majority countries of US, United States and Europe, but in Pakistan, it is still marketed as virtually trans fat-free. So VTF Banaspati or VTF Banaspati, that is marketed as having less than 2% of trans fats. But of course, the data, I don't know, I'm not a nutritionalist or the researcher in that area, so I cannot say that it works, it is actually trans fat free or not. But I try to get my patients off that very quickly. And extra virgin olive oil or butter or ghee, that is a luxury that majority of my patients anyways, they cannot afford. So I try to switch them on refined oil, canola oil, because that is the most affording one, and its fatty acid composition is closest to being that of the olive oil. It has lots of monounsaturated fatty acids. So I try to start by that area, and stopping that Banaspati is the first task that I give to my patients as well.
Thank you, Doctor. Very enlightening. And I think you have special coaching skills considering the environment that you're operating in, which probably many of us wouldn't, come across. So thank you so much for sharing. I'd like to, understand a little bit more on that, coaching and, the challenges in the low carb adoption. So if you can think of one case that you worked on where you had to navigate your patient through the low carb adoption, considering the environment again you operated.
The issue is that once you cut the carbs, then from what macronutrient you are supposed to replace them. So the only way of replacing carbs is by getting the protein dose optimal and then increasing the fats. So increasing the fats also, such patients have heard a lot of bad things about fats. The first question they ask is, why you are asking me to take more fat when all other doctors are telling me to go low fat? So there are two ways. Either you can go low carb or low fat. So once I had such a patient which was cooperating with me, but he was not financially that well off that he could afford buying protein. Then I advised him to get his hands on chicken feet and make a bone broth out of that for a few weeks. So because chicken feet, that they are usually thrown away by the vendors, or usually the people who are making animal feed, they take those away. So first he was reluctant and he was telling me that your brain is just not right. You are telling me to take things which are not allowed religiously. But then I told him that there is no conjunction in Islam which stops you from taking chicken feet, or at least a part of that. Then I showed him videos by which various countries and low carbers were making multiple dishes out of those. But I told him, I don't want you to take that, just make a bone broth. And by minced meat and chicken feet, he achieved his diabetic control and his hemoglobin A1C went down. So sometimes, because this affording patient coaching is very easy, but somebody who is not affording enough, then life is very difficult for such patients.
Wow, I think I personally learned something new. I think that's the innovation you bring in. When there are constraints in our environment, I think the best comes out of everyone. So amazing, doctor. Thank you so much, for that story. Doctor, I'll move to the last couple questions here. Just coming back a little to your personal side here. What next? What have you been thinking, as your role as a doctor, adopting low carb? What are you thinking next 2 years, 3 years, 5 years for Pakistan?
I think many nutritional coaches will emerge, and the physicians will also learn and attend the nutrition network courses. I also plan to do the same. But unfortunately, the fees is too high for many of us. to become certified. And I think that n is equal to 1 experiments on Facebook will force our community to gravitate more and more, and finally publishing will come. It will follow eventually. So I hope so. And also one more thing, I think that the chefs in our part of the world, Indian chefs, I have all the regards and respect. They are much more advanced than ours, but how to reduce the carb amount in routine dishes such as halwa puri or some breakfast items in Mumbai or local regional settings. Say, for example, you are going for upma or sambar or things like that our chefs also need to take active part in making the same dishes but reducing the carb count. So the culinary community in our part of the world also needs to make carb content less for the same. For example, sweets. If you are eating laddus or gulab jamuns, then how to reduce the carb count in that from 50 gram down towards 5 gram. So the Europe and US side is quickly gravitating and changing. The chefs are adapting for general population. Plus, many keto products are available off the shelf in the Western countries, and that is very difficult to do in a resource constrained setting or even in a big cities such as the countries like ours. So I think that is the future. I would try to take part in that future as much as possible.
Great. I think you're hitting many different angles and parameters here. The ability to cook low carb keto and the skill is slightly different, but can catch up quite quickly. So that's a great angle or a story that you brought about. I also wanted to ask you around children, and I'm sure in your practice you come across a lot of children. Just talk to us a little bit around the current, what you're seeing in Pakistan with regards to children. And I am of a firm belief that, we often blame the genes. It definitely has some roles, but I know as parents, what we practice obviously goes to our children. So I just wanted to understand what you're seeing and how you're coaching parents, towards that.
In children and teenagers, the main problem is the food delivery sites in big cities in Pakistan. And so I'm sure the same is the situation in India. And most often than not, the teenagers are the more problematic ones. And the small children, either they get the food in the house or they start to have sweets from the very beginning. And as a result, either they are nutritionally deficient or they are overweight. So it is one of the two. In very few cases, I see patients who are small children and they are having the optimal amount of nutrition that they need. Although it is not an active area of my practice, as I mainly deal with adult patients, but seeing my community and my local big cities, usually teenagers are losing the ability to cook. Because of the food delivery sites, it is very easier for them to get donuts and pizzas and all that things. In big cities, it is a big rage. I don't know how it will improve, but probably in the schooling age, it should be mandatory for kids to learn basic cooking and basic nutritional classes. Even while we are training to be a doctor, there is very little emphasis on nutritional training or the food quantity and quality and things like that. So these things need to change, and they need to change very quickly. If we need to reduce the impact on the society as a general.
Great. Thank you so much for sharing, that insight. Again, your ability to think is, par excellence, doctor. So thank you so much, for sharing that. I would like to leave a couple minutes for you to share any message to the Asian community, in general, and Pakistan, India, Nepal, all the subcontinent countries, subcontinent, around any messages that you have. I think you closely have watched the Asian community through your practice.
So I would just like to give a single message, and that message will revolve around that don't look at the diabetes numbers and think that you will not get affected. As you age, the incidence of metabolic syndrome, cardiac issues, and diabetes goes up and up and up. So if less than 10% of 20-year-olds are having diabetes, then once you cross 60 years old, your ability to handle carbohydrates goes down and down and down. So as you age gracefully, even if you don't have any illness, kindly reduce or eliminate your sugar intake. That will be number one, even if you are a normal person, 40 plus. And the second step is, depending on your life situation and your food choices, reduce little amount of carbohydrates. If you are going 75%, go to 45%, 55%, as your lifestyle advises you. But sugar is the main culprit. I also think that in our people, sugar is the main culprit and meat is not the main culprit. Meat in its, if you are going to McDonald's and ordering a large Coke and fries and the burger, the meat in the burger is not the one which is responsible for your illness. It is the fries and it is the Coke and the bread. The three other things which you think that they are benign and they are of no significance. Another thing that I would like to advise our people is that one is the source of sugar which is in front of us in the form of the tea or in the form of cold drinks. But the other sugar is the hidden sugar. Say, for example, if you are having 3 tablespoons of ketchup, that has more sugar than a glazed donut. Similarly, the barbecue sauce is consisting of 50% plus only composition is that of sugar. So try to stay away from hidden sugar as much as possible. And that will be enough for the majority of people. So take home message is to...
Thank you so much.
Sir. Thank you very much.
I think you hit a lot on the key notes. Thank you so much, Dr. Kazi. In knowing you, I understood a lot of new coaching skills in the circumstances you operate in. I commend you for the work you do. We have Shashi here, who also wanted to be with us and you for a few comments from his side. Go ahead, Shashi.
So, Dr. Iftikar, thank you very much. And we have been following each other in Twitter X, and we know the kind of work. But then we know the story, your personal story today, I think, when we saw that picture of before and after. And the best part is, like, you are working not in the main city, you're in the interiors, which matters much more. And the kind of solutions which you are given to a patient are really, I think it is out of the world. And I think there's something to learn for all of us. And rightly, as Sandesh, we have been discussing, that we see the incidence of diabetes, prevalence of diabetes seems to be very high in meat-eating countries, including India, where meat-eating states seem to be high. But the question always remains is, how do we eat meat? So it is prepared in a lot of refined omega-6 seed oils. And we tend to have a lot of rotis with that, or rice with that, a lot of carbohydrates, especially refined carbohydrates. Most of the rotis must be made from maida or refined flour, and add sugars in form of having some sugar sweetened beverages, as well as all those, as you had mentioned, all those sauces, ketchups or something. These are all something which is terrible. Plus our low personal fat threshold. So we cannot hold on much fat, and our liver gets full and inflamed. And that's why we have a lot of central obesity, which is seen. And your unique way of solution of a poor person who cannot afford rich food, go and have bone broth made with chicken feet. I think it is very, very unique, which all of us can learn from, I think, each other. And I so thank you for coming and sharing the knowledge. Your knowledge
I'm a big fan
important.
of yours, sir. I'm a big fan of yours. Follow you on Twitter and
Thank
your
you.
recipes also.
Thank you.
So
And
thank you very much for having me, sir.
And you will have full access to D-Life in recipe section. Once we finish this event, Anup Singh will give you full free access to D-Life.
Thanks a lot for that.
So you'll
Thanks a lot for that.
And Dr. Iftikar, personally, since you told that the cost seems to be issue when it comes to Nutrition Network course, so I'll speak to them and see that if we can get a good discount for doctors like you who wants to, because they want doctors like you to get educated on low carb nutrition, get certified, so that, because if one doctor applies low carb, then there are chances that there are thousands of patients can be healed with low carb nutrition. So I thank you very much for appearing in this platform, Dr. Iftikar.
Thank you very much, sir.
Thank you. Thank you very much.
Thank you, Doctor.